Hi, I'm going to talk about the Graston technique and how you can use certain Graston tools to help break down muscle tissues and fascia, and connective tissue that could be damaged or have scarring or lesions. Um, and there's different types of Graston, which is nice. There's different types of tool to use the edge and sizes and shapes to really be precise in what you want to accomplish with your technique. You usually apply some sort of like lotion or lubricant to make sure the Graston tool apply or runs smoothly along the area. They have a long one which I've used to help you just run over smoothly over the area, just like they call it like a scanning kind of technique, to feel for any kind of crepitus or like little crunchy bits and stuff to see where any lesions or scar tissue or adhesions could be. And then once you kind of use the scanner to find that, you can go in with the Graston, and you can use it like as a cross friction. So let's say the muscles and the fascia are going this way, you could take the maybe like a tongue depressor shape they like to call Graston tool, and you can go along the opposite way, kind of breaking apart the fascia this way if it's running along this way. So that helps kind of bring in more blood flow, help break up the fascia and promote that healing process again, and kind of help get rid of any unnecessary scar tissue and stuff that the body tends to lay down. Because sometimes the body likes to lay down a lot of scar tissue all at once when it's trying to heal. Because it wants to heal quickly and I guess efficiently, but it'll just lay it down. But Graston tool can kind of help break that up, which is really cool. Graston is also really best applied with other things like stretching, mobility exercises, and sometimes if you are doing Graston right, it can cause discomfort during the treatment, but you don't want it to be to the point to where it's so painful that maybe it's gonna cause some soreness like over the next few days, or it's gonna cause like ecchymosis or bruising. There is a term called tiki-eyed with Graston where the skin will start to turn slightly like red, like a little flesh color where you've been applying the technique. So it almost looks like, if you think of like a tiki head, it has like the glowing red eyes. So you can kind of think of it that way. And once you get to that point, I would recommend so you could stop your Graston technique. You want to apply good enough pressure to where you are maybe putting the athlete or patient through a little bit of discomfort, but you don't want to apply so much pressure to where you're getting that tiki eye immediately, or you're getting any bruising with that. So those are some precautions to think about when doing Graston. And yeah, thank you very much.